Hello, my beloved doctors. I am Dr. Ramy, the cardiovascular specialist, and I'm sending you lovely greetings from Ramy Cardio Club. I would like to start with you with the neck veins examination. Neck veins examination for many of us is a very hard topic. It's the thing that you would love that they deleted from the medicine, but actually it's very attractive to your examiners. You have to know it by heart. Whatever your test, oral exam, or multiple choice question, or a written one, you're gonna have neck veins examination questions. Also, it's very important for you clinically as a doctor. So it's very important for undergraduates, postgraduates during your study, and I'd like to assure you that by the end of this series, you're gonna ace any question regarding this, believe me. So neck veins examination for a cardiovascular examination is part of the local cardiac exam. For other specialties, it's a kind of general examination. Before going in the details of neck veins examination, I'd like to go briefly through the cardiovascular exam. Cardiovascular exam should be general examination, local examination, as everybody knows. General examination, you have to have a general look on your patient, whether he is depressed, he is respiratory distressed, he is coming on his own, he's coming surrounded by family members because he is very weak. You have to assess the general look of your patient, and it's very critical to assess the conscious level because your patient may be drowsy due to hypotension, may be shocked because he is in syncope at bilirubin. Also, your patient may be cyanotic because he has a cyanotic congenital heart disease, because he has Eisenmenger syndrome, because he has pulmonary edema causing hypoxia, because he has inhaled CO, carbon monoxide, because he used many tablets of nitrates, sublingual nitrates, so his methemoglobinemia causing hypoxia and the changes of his color. Also, your patient may have malar flush, which is an abnormal complexion. Malar flush, which is clinically like what you see for lupus patient, but malar flush for a cardiac patient is associated with mitral valve stenosis. Also, your patient may have puffy eyes because of hypothyroidism or because of albuminuria if he has a cardiorenal disease. Thyroid examination is very important for a cardiac exam because thyroid is linked to many cardiovascular diseases. Hypothyroidism causes sinus bradycardia and causes left ventricular hypertrophy. Hyperthyroidism causes sinus tachycardia or atrial fibrillation. And both hyperthyroidism or hypothyroidism causes hypertension, so it's very important. Vital data, blood pressure, pulse, temperature, and respiratory rate is so important. Lower limb examination for having edema, for assessment of peripheral pulsations, varicose veins, ulcers, neuropathy if your patient is diabetic is very important. Abdominal examination to check for congested liver, to check for epigastric tenderness, because many of our patients comes to your clinic complains of an epigastric area. Epigastric area is common between the abdominal disease and the cardiac disease. Your patient may have epigastric pain because he has an inferior wall ischemia, or he has gastritis, cholecystitis, pancreatitis, or more critically, he has an abdominal wall problem, dissection of abdominal aorta. dissection of abdominal aorta. So it's very important to examine his abdomen. Chest examination, because if your patient has heart failure, you're gonna have basal fine crackles. If your patient have a clear chest disease, maybe this is the diagnosis, not a cardiac problem, you're gonna listen for bronchospasm, chest wheezes, or coarse crackles because he has lung fibrosis, he has pneumonia, or he may have pleural effusion, which explains why he has shortness of breath. So chest examination is very important. Local cardiovascular examination, it's starting with inspection. You check for the apical pulse, you check for other pulsations, you check for dilated veins on the chest wall. Palpation, you have to address the exact location of the apex and see if it is deviated. The normal site is in the fifth intercostal space at the mid-clavicular line, which means just below the nipple of the breast. You have to palpate for having a thrill or heave due to right ventricular hypertrophy. So palpation is important. Auscultation, to listen for the normal heart sounds, S1, S2, physiologic splitting, not physiologic splitting of S2. Also, to address if the patient has S3 or S4 due to ischemia, due to left ventricular hypertrophy. This explains S4 just before S1, S3 for heart failure, for hyperdynamic circulation, which you have it physiologically with pregnancy, or with anemia, or with hyperthyroidism, or having AV fistula, wherever. Also, during auscultation, you will hear murmurs. You're gonna check for murmurs, whether systolic, whether diastolic, on the mitral, on the tricuspid, pulmonary, aorta, and you're gonna address all of these. Lately, neck veins examination comes, because this is our topic, neck vein examination. The first question is, why neck veins examination is very important? Because it helps us evaluate the right atrial pressure. So the next question is, why right atrial pressure is very important? Because it gives us an idea about the intravascular volume estimation. I would like to know if my patient is dehydrated, I mean hypovolemic, or he is overloaded, hypervolemic. Because we know that many cardiac problems causes the patient to be volume overloaded, because he has left side heart failure, because he has severe valve lesion like tricuspid regurg. So it's very important to assess the intravascular volume, to know if your patient needs more fluid or he needs diuretics, and you follow up the improvement of your patient. Hepatojugular reflux, which is kind of examination for right side heart failure. Cosmal sign, which is very interesting because it is paradoxical rise of the jugular venous pulsations on inspiration. Physiologically, on inspiration, the intrathoracic pressure drop, the venous return increase, and the neck veins should collapse because blood moves faster to the right side. But if the patient had the opposite, on taking a deep inspiration, his neck veins pulsations rise and the neck veins is more congested, this means that he has a very rise and very increased intrathoracic pressure due to constrictive pericarditis due to pericardial tamponade, because he has right side failure, because he has tricuspid valve stenosis, because he has pulmonary valve stenosis, because he has pulmonary embolism. Everything that makes the right side pressure very high may cause cosmal sign. Okay, so before going through the exact steps of neck veins examination and its tips and tricks, we should talk about the anatomy of the neck veins. Anatomy of the neck veins. The major veins we are examining during the neck veins examination is external jugular vein and the internal jugular vein. External jugular vein and the internal jugular vein. When I say external, because it is superficial to the cleidomastoid muscle, sternocleidomastoid muscle, which is this. This is the external jugular vein. The internal jugular vein will lies below the sternocleidomastoid muscle. This is the internal jugular vein. So it is internal to the sternocleidomastoid muscle, or external jugular vein external to the cleidomastoid muscle. Okay. Alright. The external jugular vein is formed by joining two veins together. The posterior auricular vein, which drains the scalp, and the retromandibular vein, which drains the skin of the face. Alright, they join together at the angle of mandible here and continue like this to end in the subclavian vein on the right side, or the brachiocephalic vein on the left side. The internal jugular vein is the continuation of the sigmoid sinus. Sigmoid sinus is responsible for the venous drainage of the brain, the dural sinuses, which ends as an internal jugular vein, passes through a jugular foramen in the cranial bone and goes through the neck, just beneath the sternocleidomastoid muscle, in the carotid sheath, and then joins the subclavian vein on the right side, or the brachiocephalic vein on the left side. Another photo. This is the internal jugular vein, which comes as a continuation of the sigmoid dural venous sinus. Right. Another photo. This is the internal jugular vein. This is the external jugular vein. This is the right subclavian vein, and this is the brachiocephalic vein on the left side. The brachiocephalic vein joins the right subclavian vein to make superior vena cava. Superior vena cava drains into the right atrium. So the transmitted pressure from the right atrium through the superior vena cava through the internal and external jugular veins gives us an assessment of the right atrium pressure. So it's a very important question right now. Why you choose internal and external jugular veins to assess the central venous pressure? Because they have more straight line anatomy, so they can be very easily seen and assessed, and they can be used as a mirror for the central venous pressure inside the right atrium. As you see here, the brachiocephalic vein cannot be used because it's not straight, it's more horizontal. Subclavian is curved, so the most straight one is the internal and external jugular vein. Another question, which vein you use more for the central venous pressure assessment, the internal jugular vein or external jugular vein? Both can be used, but actually the more likely to be seen clearly is the external jugular vein. The external jugular vein, because the internal jugular vein lies just below the sternocleidomastoid muscle and it's a little bit hidden. You cannot see it clearly. So external jugular vein is used most, but both can be used. They have the same anatomy and the same end. Another interesting thing, internal jugular vein has at its end a valve while it is joining the subclavian vein. So you can depend on it for central venous pressure assessment. And subclavian doesn't have it. Brachiocephalic doesn't have any valve. So this is another point which help us know why we use the internal and external jugular vein. External jugular vein doesn't have valve at its end, but internal jugular vein has a valve. The next session we're gonna know the exact steps for assessment of the central venous pressure using the neck veins. Stay tuned.